What follows will be a discussion of the Reiner case, the murder of Rob and Michelle Reiner by their son Nick. To be clear, this discussion is not going to be based on any clinical data because I don't have any of the clinical data available to me, but it will be inferences from what was reported in the media and what we know about his case overall. Inference leads to the formation of hypotheses, and it's the kind of thinking that a forensic psychologist would apply when reviewing all of the medical records, which are likely extensive, given the fact that it has been reported by his father, when he was still alive, that he had been treated about 18 times for his substance abuse, and we don't know how many times for mental illness. I will start out by saying that based on what I've read in the news and from various information sources, that this has to be one of the most complicated cases that I have ever seen. And when I say that, I will add that treatment would have been very difficult from the beginning, given the number of symptoms that he has presented over time. So, if you're listening to this, let me say, put on your thinking cap and I will put on mine, and I will present what I see as the significant issues that are publicly available, given history, statements by his father, and also statements by Nick himself. This is also a bit of a morality play. That is a drama about mental health treatment, how it's changed over the years due to lack of financing by the government and the lack of interest in people paying taxes in order to support the mentally ill and have them treated. It's also a reminder that the alternative is to release them to the community, where people like this are frequently arrested and put in jails until their release, but that the jails are really not prepared to accommodate very many people with mental illnesses. More than that, it's far more expensive to keep the mentally ill in incarceration, which is still another reason why they are often released, with the hope that they don't return, but with the inevitability that they will. What kept drawing my attention back to this case were several photographs that were posted online of Rob Reiner smiling warmly with his arm around his son, who was looking extremely uncomfortable, if not completely disturbed. This episode is going to be accompanied by one of these photos, the one that I found particularly disturbing, although I realized afterwards that it wasn't a picture of father and son alone, but that there were other people in the group when the shot was taken. But with the way the photo was cropped and distributed to the public in the media, it really almost looks like a portrait of good and evil. It was the warm smile that Rob Reiner had with his arm around his son. And there were several other photos like that I have seen where Rob looks consistently warm as he is holding his son with his arm around his shoulder, while the son, Nick, looks extremely disturbed. It really brought to mind a very basic question that has followed humanity probably for thousands of years. Are people really good? And if so, how could this murder have possibly occurred? Especially when all reports in the news are that Rob was consistently available for his son whenever he needed him, and that his work schedule never took him away from helping his son. And we can allow him some leeway in that regard. He couldn't be available 100% of the time with his schedule, but even if it was 50 or more percent of his time, that would be more than most people get from their parents, because most people at Nick Reiner's age would have left the nest and found some independence to live on their own without needing their parents' support. But I want to begin with the easiest question first, the one that almost all lay people bring up whenever a discussion like this occurs. That is, whether someone like Nick Reiner really only needed tough love in order to be able to grow up properly, instead of the kind of warmth that his father consistently offered him. The idea of tough love is hardly new, and immediately it drew my attention to what I believed was a Bible quote which I found online, not being a religious person myself. The quote is from Proverbs 13:24, which, if you don't know, and I happen to know almost by accident, is from the Old Testament. This is not a Christian idea, in other words. And it states, "Those who spare the rod hate their children, but those who love them are diligent to discipline them." It is clear that the idea of tough love comes out of this part of the Old Testament that goes back thousands of years. If this teaches us nothing else, it's that proverbs like this, coming from antiquity, are not necessarily correct for their age. And using its antiquity as proof of its truth only shows that people may not have been right in how they behaved even back then. Experience being the best teacher only sometimes, but not always. I'll go further and say it is not proof that Rob Reiner's treatment of his son, by consistently supporting him and being available to him with a warm arm around his shoulder, made Nick Reiner any worse for this kind of family support that was readily available. But this also argues for the fact that Rob Reiner's support of his son, the warmth he showed towards his son, and his consistent availability did not make his son into the compassionate person he would have liked him to be. So we can also draw the conclusion that simply by raising someone with kindness doesn't necessarily mean that they will turn out to be a kind person as an adult. I would have been happy to explain this to Rob Reiner had I known him, because I myself had been through similar kinds of problems growing up, only I was the younger brother of a bipolar and sociopathic older brother who was extremely abusive not only of me but of other people. Which leads to a still bigger concern of mine regarding this case, and also based on my personal history. That is, that there is a lot of bad advice going around, including from professionals upon whom many people rely in order to decide how to deal with their out-of-control children or other family members. The difference is, if you get it at my age, that is when I was very young with a brother that tried to kill me on a couple of occasions, although I didn't realize that until recently, strangely enough, here in my mid-70s. My brother also met an unfortunate fate years ago, just 3 days after his 65th birthday, when he was murdered in Honduras. I later found out that he had been living there for 17 years, and that Honduras had the highest murder rate in the world. But he managed to forego that fate for all of 17 years until he did something to cross somebody who decided that they were going to kill him. But as complex as my brother's case was, it was hardly as complex as the case of Nick Reiner, who was duly diagnosed with both a mental illness and with one or multiple addiction disorders. The big debate among clinicians, whether the addiction creates the mental illness or the mental illness creates so much stress that the subject ends up getting addicted in order to avoid the symptoms that he finds so painful. But further, there is the question of whether or not Nick was accurately diagnosed or even completely diagnosed, because there may have been additionally underlying psychological problems that were not recognized by his treatment providers. I will say that the early diagnoses I have seen, that is, first schizophrenia, sounded like an easy diagnosis to make, but might not have been complete in its accuracy. Then came out through the media the idea that he was schizoaffective, which actually seems to conform much more with the kind of behaviors that might have led to his acting out. It is not that people suffering from schizoaffective disorder have a higher potential to kill people than anyone else, or even schizophrenia for that matter. But schizoaffective is most believable because it encompasses symptoms of psychosis that are consistent with schizophrenia, but in addition also has symptoms of an affective disorder. Affective disorders being either depression or mania, and sometimes both, which are more familiar to people because it is consistent with bipolar disorder. So you have three different possibilities with schizoaffective. That is, that there are psychotic symptoms, there are depressive symptoms that may be depression-like, that there are manic-like symptoms, or that there are both, so that he would have moments of extremely depressed mood, or else agitation consistent with mania, or he might have mood swings that are familiar to many people as being associated with bipolar disorder. That is, periods of mania followed by periods of depression that return to mania on occasion, and that these mood swings back and forth are only made worse by the use of substances, especially amphetamines or cocaine, which contribute to the agitation that is associated with bipolar. But I'm here to say that even this might not be the full diagnostic picture, even though his treatment providers might think that it is. This is not to say that I know better than his treatment providers, because I don't have access to his records, and I have no information that would support my hypotheses. But asking the question should not be an issue for anyone who is providing treatment to someone like Nick Reiner, because these questions can be settled as long as sufficient time is taken to do the examination. But at this point, I'm about to get into the weeds in our discussion. I'll try to make it clear and simple enough that most people will be able to understand it. Not that I assume that I'm talking to people who don't have the sophistication or the intelligence to recognize what I'm talking about. Rather, the more I discuss these issues, the hope is the general understanding of mental illness will be passed along by people who can see the logic in what I'm saying. I'll start out with a comment about diagnosis in general. Once clinicians arrive at a label that they apply to a specific patient, it does nothing more than narrow the set of symptoms that everyone is looking at when they attempt to understand what the mental impairment might be in this particular case. It doesn't address causes, and in general, once the label is assigned, it's very rare to have any deviation unless some new information is so persuasive that they change the diagnosis. So when you go into a treatment team meeting where all the professionals are assembled and people who provide care on a ward or a unit at a hospital or a jail, they are all talking about the same thing and about the same set of symptoms applied to the very same patient. And oftentimes there's very little outside of that is introduced. So if you diagnose someone with schizoaffective disorder, as Nick Reiner has been, you immediately look at the medications and whether or not they are effective and whether they should be continued, discontinued, increased, in order to manage the symptoms that are observed in any unit or in the home if Nick were still out in the community. But the important thing is the medication's effectiveness, because if the medication isn't doing anything, then it needs to be changed, or an increase in dosage needs to be considered, although I'm not even suggesting that here where Nick Reiner is concerned. I want to interject the questions that I would ask if I were new to a treatment team treating Nick, not with the goal of changing anything regarding his treatment or even in his assessment, but rather so that I could understand exactly how we got to the point where he was incarcerated or hospitalized, whichever, and how his treatment in those confines are appropriate for his condition. The first question I would ask would go back to his childhood, where they said that he was highly impulsive and had a difficult time regulating his own behaviors with disruptive outbursts and intense emotionality. I might ask whether he may be suffering from temporal lobe epilepsy, which often results in impulsive aggressiveness and acting out. There is a question in my mind as to whether or not he may have been suffering from this condition even in childhood, although I think it is a question that would need to be eliminated and can be eliminated easily by giving Nick an EEG, an electroencephalogram, to see whether there are any spikes in the electrical activity of his temporal lobes. I don't assume that this hypothesis is necessarily correct, but it is verifiable, and that's one of the reasons I would want to eliminate it early. The only problem with this kind of an assessment is that EEGs often produce false negatives, which is to say that they don't find a pathology there when there may actually be one that exists. It can be very difficult to track down whether or not an EEG is an accurate portrayal of brain functioning in a subject. But it is a place to start, and it is a question that may be answerable. My next question would be whether or not he has suffered from borderline personality disorder, and whether it may have first appeared, the symptoms of which may have first appeared in his childhood. I don't assume that this is correct, but if we're really to make a thorough diagnosis and get closer to an accurate one, we might want to consider this as a possibility as well. Symptoms of borderline are a frantic effort to avoid real or imagined abandonment, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation, an identity disturbance, markedly and persistently unstable self-image or sense of self, impulsivity in at least two areas that are potentially self-damaging, recurrent suicidal behavior, affective instability due to marked reactivity of mood, that would include irritability and anxiety, dysphoria, chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, and transient stress-related paranoid ideation or severe dissociative symptoms. The best way to track this down would be to interview not only Nick, but his surviving siblings, who would have the experience of his behaviors growing up. With his accepted diagnosis of schizoaffective disorder and his treatment for that disorder, the reason to track down any additional diagnoses is to see whether there are any other forms of treatment that might be additionally helpful. It's not necessarily with the intention of piling on diagnostic labels to make things more complicated, but rather to make treatment more structured in its approach to him if diagnoses can be more accurately identified. Although I should add that I am not assuming that my hypotheses are correct, but am introducing them so that we understand what kind of pressures Nick may have suffered, even from a very early age when he started demonstrating personality symptoms. Still more, what should be added are substance abuse diagnoses, which were known and apparently the first things to be identified when referring him for treatment. One of his drugs of choice, at least from what I understand in the media, was methamphetamines. These substances are considered psychomimetics, which is to say that they can increase psychotic symptoms or even cause psychotic symptoms, which is probably the reason why it is thought that he was under the influence of methamphetamines when he killed his parents. He may have used so much that he went into a state of psychosis committing the acts. Still, other things to consider in regards to his diagnosis and treatment is the fact that very likely from an early age when he first started acting out, that his parents did the best they could and provided the most stable, loving environment that they were capable, with the hope that he would respond to that kind of supportiveness and consistency in the family home. But what he would learn from this family stability and the rewards and punishers that would be administered in the family would teach him basically the social skills necessary to convince people that he was doing much better when he really wasn't. This is also a learned behavior and complicates the problem of diagnosis, which is to say, if he had been diagnosed earlier, before his parents elected to take him to treatment, and a treatment program could identify all of the applicable diagnoses and the kinds of treatment that would be effective considering the various kinds of symptoms he presented and their causes, then there would have been a better opportunity to bring him under control. But as for right now, the accepted diagnosis that's in the media, and a reasonable diagnosis, I will add, is that he suffers from schizoaffective disorder, which is a combination of schizophrenia, a psychotic disorder, and affective disorders, which can be borderline or depressive. But given his shifting moods, there may be other causes, as I suggested previously, that is, the possibility of temporal lobe epilepsy or borderline personality disorder. The easy assumption is that his rapidly changing moods are facilitated by his use of substances, especially methamphetamines and cocaine, but that it can be assumed that if these are withdrawn from his use, that he would begin to stabilize in that regard, and that more active treatment could be taken for mental illnesses while his use of substances is entirely restricted. But successful treatment could not be expected necessarily if he were treated simply for his psychosis and his depression, with no effort to address the possibility that there was an underlying personality disorder or even an organic problem associated with temporal lobe epilepsy, which is not to say that use of an antipsychotic would be irrelevant under these conditions, but rather if you can bring his psychosis under control, you would have a better opportunity to see if there are any other symptoms that may be associated that can also lead to the kind of aggressiveness that has been witnessed in the past. So treatment could go and should go step by step to bring his behaviors under control. And still further, the report was that he had a change of medication not long before he murdered his parents, and that this change led to increased agitation and bizarre behavior. What the media is unclear about is whether he had a medication change or an increase in the amount of medication he was administered that had been successful to that point. When I heard that it might have been a simple increase in the amount of medication he was taking, I was reminded of my earliest training at the state hospital in New Mexico in the early 1990s. Back then, we had drug representatives come into the hospital on more than one occasion, I remember two, where they both discussed the same thing, the possibility that if you have a successful antipsychotic for treatment of a mental illness, that increasing the medication might actually have the reverse effect of what you're looking for. They said that psychotic symptoms could be increased if a successful dose is brought up with the hope of even being more stabilizing as a treatment, but that it often happened that the opposite would occur, that it would increase psychotic symptoms, making the patient deteriorate. Now, to a new psychologist, it sounded very interesting, but I didn't see how it could apply immediately, although I would pay attention to what was happening on the ward where I was treating. It was the very earliest days of my work there, and I recalled that on our lockdown unit, I would be greeted daily by a man who would come up to me and talk in word salad. Now, I would first say that I had never heard word salad directly, and this was the first time, although I had heard of it as a symptom, where the mash of words that a patient utters is not cohesive, it's not grammatical, and it doesn't make sense. Still, every day this particular patient would come up to me and talk to me in gibberish. But as it turned out, I knew of another person at the hospital who knew him for far longer and who was aware of his treatment over time. This person told me that he did better on less medications and that with his current regimen he was not doing well at all. So I brought this information to the ward psychiatrist and explained what this other treatment provider had told me. And what came out of it was that the psychiatrist really wasn't listening to me at all, and I didn't have the conviction of that information because I hadn't acquired it myself, but was merely passing along what someone else had observed who was treating him, and thought it would be useful information in adjusting his medication. It did result in a medication adjustment, but unfortunately what it resulted in was an increase in his medication, which I would say was an example of the psychiatrist's oppositional attitudes, if not oppositional defiant disorder. And the patient responded to the increase in meds by not only having word salad, which continued, but also by having extrapyramidal symptoms, which is to say these are the symptoms that are the side effects, the negative side effects of treatment with an antipsychotic. What the patient demonstrated was an increase in involuntary movements, muscle stiffness, tremors, and restlessness, all of which combined were enough to have the psychiatrist once again lower his medication, but this time below what he had been taking. That caused me to approach the psychiatrist in the first place. And one day I entered the ward, opened the door, came in, and there he was waiting to greet me, talking again in word salad. But this time I listened because I thought there was something that he was trying to get across. And I asked him about that. I said, "Are you trying to tell me that you are afraid?" And he responded with, "Yes." But again, if you had simply listened to the barrage of words that he was putting out, you would think that it was totally senseless. The fact that he was able to answer my question so directly indicated to me that his thinking was clearing up. And let me say, over time, not very long, as the medication dose was decreased and there was a decrease in his symptoms of side effects, that in fact his thinking cleared up entirely and he was able to be released from the hospital. So I ask, what happens with Nick Reiner if he has an increase in medication that causes to a deterioration in his thinking? Might it be that if they had cut back on his medication or even left his medication alone at the successful rate, that he never would have had the decompensation that caused him to attack his parents and kill them? This also is unknown, and I'm not claiming to know the answer, but I'm raising the question, and I would say each one of these issues are questions that should be asked and addressed among his treatment providers in future, and probably should have been in the past, although I cannot make that judgment not having been there. But in answer to the underlying question that I asked earlier, are people good? I think that Rob Reiner, by treating his son with the kind of kindness that was reported in the media and that many, many other people had observed over time, that goodness alone and kindness alone is not enough to improve the condition of someone who is severely mentally ill, but that it can take medication and it can take a behavioral program to help the person understand how to manage their own behavior and to recognize rewards by being able to interact appropriately with others. I make no assumptions that this is necessarily correct, but really the whole purpose of this discussion is to throw out questions for everyone's consideration as they think about this case. Until then, be well, stay healthy, and especially stay sane.